Hi, welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, Communication Specialist at the Nashua Division of Public Health and Community Services, and I'm joined today, as usual, by Bobby Bagley, our Director of Public Health. Welcome, Bobby.
Thank you, Jane. It's good to be here.
So I guess we have to start with the usual, which is COVID, and maybe start with an update of what's going on worldwide and what's going on in our little state here.
Sure. It's always good to know what's happening sort of in real time. And so Johns Hopkins puts out information that's updated daily, and we utilize that information to keep ourselves informed and to keep the community informed as well. So on the global site right now, there's over 19.1 million cases worldwide, with over 715,000 deaths. So we see that COVID still has not gone away, and this pandemic is still ongoing. What we have also seen is that in the United States, we're up to 4.1 million cases at this point in time, with a death toll of 158,000. Again, this is a very serious matter that we're still dealing with in public health, and an incident that continues to go on and impact us in lots of different ways. In New Hampshire, right now, we're reporting 6,742 cases. And the good thing about that is what we know is that we have 88% recovered. And the reason why we say that that's a good thing, because we know that people are surviving. People will get ill or can become ill from COVID, but that we have a nice high recovery rate statewide. 10% of those who have been diagnosed with COVID have been hospitalized, and we're still trending at 6% as far as our death rate. And that has been consistent with us in New Hampshire for months, and that's also a good sign. Not that the loss is still not great for families, but if we're maintaining that 6% death rate, which has been consistent and which is actually really good for us.
And these are numbers, these are numbers that we are always monitoring.
These are numbers that
pretty
we
much
monitor.
Every other day.
Yes,
we are looking to make sure that there's no change, no large change up, no large change down.
Right.
Well, we're hoping for the large change down.
Exactly. And the reason why we're monitoring these so frequently is because we still have to look out for a surge capacity. As you've seen, Jane, and pretty much as many of those who have been watching the news or getting updates or reading or learning what the CDC has been putting out, we have had some states that have had an increase in hospitalization rates and death rates because of surge as a result of businesses opening, economies needing to get kick-started, and then the activities that just came on really quickly in some of these other states. In New Hampshire, we did a very gradual opening. We had very measured metrics that were put in place, and we can see the outcome of that with this consistency with our data.
So speaking of New Hampshire, we do look at another diagram that you'll be able to see. And we often look at Massachusetts. So people keep saying, but we're New Hampshire. Why do we look at Massachusetts? And, just explain the importance of that. We are a border town.
Exactly.
I guess here I am explaining it. But,
yes.
But we are a border town. And so we have to be cognizant of what's going on around us. So if you can just reiterate some of that for us, Bobby.
Yes, we do, Jane, because remember, viruses, infections, diseases, outbreaks, they don't have a boundary. So, for instance, COVID doesn't say, oh, I'm about to cross the New Hampshire border, so I think I better stop right here. That's not how it is. And so we look at our neighboring state, Massachusetts, across our borders, because it can give us an indication as we see numbers increasing. If we see surges just over our border, it allows for us to be prepared for what could happen in New Hampshire. And the reason for that is because we do have our neighbors come across the border to frequent our restaurants, to frequent our retail stores, and so we need to know what's happening in Massachusetts. And so what we look at basically is the percent positive rate between New Hampshire and Massachusetts. We've seen a decline in New Hampshire. We were hovering somewhere between 1.8 and 2.3% positive rate, and right now we're at like a 2.0% positivity rate. We look at what's happening in Massachusetts because we want to, again, see if they're having an increase or a surge in their cases, what does their positivity rate look like, and then what can we expect over here across our borders. And right now they're hovering at about 2.9%, which for both of our states is a good percentage. As long as we stay below 5%, we're still looking pretty good because it shows that we've flattened that curve out and we're still maintaining good monitoring and surveillance and good preventive activities in both of our states.
And with the contact tracing and looking at the cases, we can really see if there is a cluster or if there's a big group and how to kind of nip it in the bud.
Nip it in the bud. Yep. How do we maintain that source control? How do we stop it? Right. And that's important for us. So knowing these numbers, paying attention to what we're monitoring and what we're seeing allows for us to know how much activity we need to put in place when it comes to our response efforts and our measures.
Mm-hmm. And I was just reading this morning about Massachusetts. So they've identified 3 towns that are having the uptick. And so they will do similar to what we would do here if we saw an uptick, just so that,
right.
you know, and those were a little bit further away in Boston, in the Boston area.
Right. Yeah.
So
Boston's getting hit a little bit right now. I think they went up, surprisingly so, higher than they have been in the past couple of months, because they had gotten their numbers down pretty low. And then again, as long as there are increased activities, you can have that expectation. And so the important piece of that is, as we open up activities and we make major events available for folks, there are adjustments to our behaviors that have to happen in order for us to maintain that source control. So you'll notice I said that twice, that little source control, right? Because that's the thing that we want to do. Maintain control of the source, which is the virus, and keep that under control. And we know that there are measures that we have. We're 6 months into this. I think we're almost getting into 7. Yeah, we're getting close in there. We're about 7 months into this now. And so now we know what types of things need to be in place to stop the spread of this infection, to stop COVID right in its tracks. Oh, yes, Jane, go ahead and put it on. So we know that wearing the face coverings or mask is a great way to maintain or stop the source of this infection. Number 1, bam, source control right there, because it's stopping those respiratory droplets from spreading to me who could be infected. And so if we're both wearing our masks, right, great way to shut down this virus, right? We've always known and had the capacity to do this. And so now what we really need to do is work really diligently to do this. So wearing of the face covering, you know, the masks is really important. The social distancing, what we're doing right here and right now, has to be maintained as well. Social distancing is pretty much number 1, because the droplets can't get from you to me or me to you unless we shorten this distance. And if we shorten this distance, we need those face coverings on to prevent the spreading of those droplets. Staying home when people are sick, right? It's going to be the same message. Oh, it sounds like, oh, we're saying it again, and we will say it again.
Yes, we're going to keep saying it.
And again, and so on and so on. Because there is a way for us to really stop this. And it's in our control, and it always has been.
So we were talking earlier today about how do we challenge our community, because we talk about this a lot in our office. We're all in this together. If I don't take precautions, then I'm potentially infecting other people around me. So in our offices, of course, we wear masks. When we get into our office and we're by ourselves, we'll take them off. But what is this challenge we were talking about? I heard something about a 14-day challenge.
Yes, you have heard that. So this is what we've learned about this virus, right? We know that the incubation period is 14 days. Right? So if I came into contact with somebody's respiratory droplets and they had the COVID virus, and now I've been exposed to it either through, my mucous membranes, my nose, my mouth, or my eyes. Now, 14 days, it's going to incubate in my body, and I could possibly have signs and symptoms of disease. If we as a community took on this challenge and worked really, really hard with wearing of our face coverings, our face masks, maintaining social distancing, making sure we washed our hands in between different activities, didn't touch our eyes. I'm going to do our little eyes, our nose, and our mouth, and making sure that we clean down surfaces. And if we did this for 14 days, we could stop this virus, because it needs a human body, right? So why not starve it? Why are we feeding the beast? Why do we continue to expose each other and allow for this virus to continually thrive in our communities when we can stop it? It's a little tiny virus. I think we can stop it. So that's what the challenge is about, us being really mindful and diligent with those measures and doing it for 14 days straight.
Yeah. And we're fortunate in Nashua because we have taken measures. There is a mask ordinance if you're going out in public or into a public space, if you're going into a restaurant, of course. And if you're going even to the library, we want you to put your mask on.
Right.
You know,
Let's do this.
Take that nanosecond
Right.
and put your mask on and make
Right.
sure that you're protecting yourself, you're protecting others
Right.
from potential spread.
And you know, Jane, the reason why, so I put this challenge out. I'm a competitive person. I like to win.
Oh, so am I.
do not think, right, that this virus should be winning. I think we should, because we're smarter. We are. Because we know what needs to be done, and I think we just need to do those things. We talked about activities opening up. We talked about Massachusetts and New Hampshire. One of the biggest things that's about to happen is the launching or the opening up of our schools. And so if we can do this for these next 14 days, it allows for create a safer environment for our kids going back to school. Because if there's no virus, it reduces the opportunity of exposure. It reduces the risk. It reduces the fears that people have of the students, teachers, administrators being exposed to a virus because we've shut it down. Why not do that?
And it'll certainly make the school nurse's job a lot easier. People won't have to be so nervous going in if there's a cough or a sneeze or what have you in regards to the virus. So 14 days.
14 days. And parents, right? You can reduce the fear that parents have as well of their kids being exposed, of their kids bringing a virus home, to them, their elderly parents, other loved ones in their homes, or them being missing work or work being shut down. I mean, just think about the ramification. 14 days of just doing what we need to do, or the other.
Or going on and on the way it has.
Or it's going on and on and on when we can stop it. It's about us making those really personal choices for our own personal health and safety, and then it's going to impact the public's health and safety.
Sounds like a plan.
Sounds like a plan. Hey, challenge. The challenge is on.
The challenge is on. You heard it here first.
Yeah, source control. Let's take care of it.
All right. So just a general update. How does the division work with the schools to really advise mostly on how to open up? We've noticed in the news, the school plans in Greater Nashua are all different. And that obviously depends on how crowded your school is, what the population is, what your demographics are. We're most familiar with Nashua. Just give us a little taste of that.
Sure. So the Department of Education and our Department of Health and Human Services have been working really hard over the past few months on the guidelines. So those guidelines are out. Those guidelines allow for flexibility in each of our towns and each of our school districts to put what needs to be in place depending on the school setting for each one. And so Nashua is urban. We've got lots of schools. We've got like 11,000 kids in our school district. What we put in place with regards to the opening up of our school is going to look very different than maybe Hudson or Litchfield or some of our surrounding towns. But there are some basic guidelines that all of the schools do need to make sure that they follow. So we've had the opportunity, Jane, to participate on the school's reopening task force. I sit on that task force and I get feedback from our nurses and from our staff, our health officer, our deputy health officer, on what things we need to make sure we're paying attention to with recommendations that we make to the schools. And our recommendations are going to come from hard scientific facts. They're going to come from the recommendations that have been put out by the CDC, that are put up by our state, and that the New Hampshire Department of Education have all combined and put together. And so we're very confident that what we are looking at doing with a very measured approach, a slow approach to allowing for the kids to come together or the students to come together in a way that keeps them safe, keeps the teachers safe, and also that keeps their families safe when they go back home. So the guidelines have been put out by the Department of Ed. There are frequently asked questions and answers. Those types of documents are published on the Department of Health and Human Services website. We're going to have some frequently asked questions published on our website that we're going to work on, and we're going to continually work very closely with the school nurses and the school administration and the teachers, because every classroom and how they conduct their learning is going to look a certain way. But we need all of it to be safe for the students and for those teachers in the schools.
And what is most important in all of this is that the district really has a plan for how to react if there is a student or a teacher or anyone who has a positive diagnosis of COVID-19. And that's the most essential thing, so that it's not, as we were discussing in the office, it's not necessarily going to close it all down. We're just going to have a plan on what to do, and we know what to do now. So I think that people can take some comfort in understanding that.
Right, and I mean, if we think about it, in public health, we've been responding to communicable diseases forever, and we've done that very well with our school. COVID has presented in a very different way because it is a novel virus, right? The communicability of it, from one person being COVID positive to having contacts up to 3. And it depends on the setting. And so when we look at what we're expecting in the schools, if there is one child in a classroom who has symptoms, that child will be identified, and then that child will be asked to be kept at home. If the test for that individual comes back positive, what we're going to do is what we always do: take a look at the setting. Where the schools the recommendation is that they maintain social distancing as well, so as best as they can, 6 feet apart, having the masks on when they're in classes and in sessions. So all of those things will be taken into consideration when we do our case investigation. What was the student doing in that particular setting and in that context? How many people did the student come into contact with less than 6 feet and for longer than 10 minutes. And so when you take a look at it that way, then you can rule out how many people need to be put into quarantine, and how far your reach has to go out for the contact tracing. If there's one student in one school and another student in another school and another student in another school, say the grammar school, the middle school, and the high school, we're going to investigate those cases as individual cases and follow our protocol for contact tracing and disease investigation. If we happen to have, Jane, a student in a classroom who's out because they were infected with COVID, and then there's another child in that classroom that then that shows signs and symptoms 3 or 4 days later, we're looking at, could this potentially be a cluster in that particular classroom? And if so, measures will be taken again with regard to our response, disease investigation, and contact investigation in that particular classroom. And when we identify clusters, the response to that particular setting, there may be more that's done in that particular cluster because the possibility that there's more exposure. So then more kids and more parents will be notified of what's happening in that particular classroom or in that cluster. If there's one case, it's one case. There's not a widespread notification that goes out if there's one case in a classroom, because it's an individual setting for that particular situation.
And it does ring true. The nurses have been doing this
We've
forever.
been doing this forever.
And I know
and
my own kids have gotten notifications.
Yes.
There's strep throat in your classroom, or there's chicken pox, or whatever the case may be. So this is, we're just honing our skills in
Yes.
public health and doing this at a warp speed now.
Yes.
And we're getting really good at it.
Yeah.
So
And the
that's
communication is going to be really important. We really want parents to communicate. And the thing about this, and so we're talking about our 14-day challenge for one. Like, if we need to start this now, though, so we can reduce what's out in the community, because we have community spread. And so if we can start from day 1 today and do this over a period of 14 days, we can kind of it may have to extend past 14 days, all right? So let's just do 14 days.
Don't stop.
Right? But the thing that we want our parents to do at home in preparation and when school starts is, if your child has symptoms that are atypical. So if you have a child who's asthmatic and they have certain presentation, that's going to be normal for that child. If there are new symptoms that the kids don't normally have, those are the symptoms that you want to pay attention to. If it's a sniffling, coughing, sometimes they're not going to present with fever, so we don't want people just waiting for fever. But some of the other things, complaints of a belly ache, because one of the symptoms in kids is that they have GI upset. Their stomach may be crampy, they may have some diarrhea, or they're going to complain about having stomach pains. Those are the things that we want parents to pay attention to, because those are new things. If they don't have like Crohn's disease or something, this is going to be new presentation for their child. So we want them to pay attention to that. We want those kids to be kept at home. We want those parents, if they have a primary care provider, to call that primary care provider. If they don't, call the health department. Call us at 589-4500. Call us or at our hotline, 589-3456. Ask the questions, make that communication, and get some guidance. Kids that are presenting with certain signs, COVID-like illness, we want them to stay at home. Again, you're reducing that source in the school, source control. That's what we want to make sure that we can maintain.
And as you said, the communication is essential
Communication is going to be essential.
So parents really need to notify the school nurse, or when they're calling their child in sick, they need to let them know why.
Right.
Because and again, it's that whole source control, nip it in the bud.
Let's cut it off at his knees.
So I just want to backtrack a little bit to our 14-day challenge, because we have a really nice graph to show people. And we had a question about, does mask wearing really reduce deaths in New Hampshire? And we really couldn't put it in those terms, because most of our 80% of our deaths have been in congregate living situations. But what we can say is that we have reduced the number of cases per day. So we have this great graph where we see, cases per month, average cases per month. And we see in May we were really peaked with cases, and that it has steadily declined. And I think that's kudos to people really taking precautions and wearing the masks. And I guess my message by showing people this is that it seems to be working. So please continue on, meet our 14-day challenge.
Yes.
And wear that mask and wash your hands and stay 6 feet apart.
Yeah. And you know what? Nashua should really be congratulating itself. Our community has responded overall very, very well to this, working collaboratively together with public health, and just looking out for each other. And as you mentioned, with the precautions that have been taken, we have seen a decrease in our new cases by month in Nashua. So in May, we had an average of 8.74 cases in the month of May, an average, right? And then we see in June that dropped down to 5.57 cases. And then in July, it dropped down to 4.48. So yeah, we are doing the right things.
Going in the right direction.
We're going in the right direction. Let's just nip it in the bud. Let's just take that challenge. Let's just do all the things that we need to do with the wearing of our face coverings, our face masks, our social distancing, washing our face and hands, cleaning off those surfaces, staying home when we're sick. Let's just do those things, and let's just see that average continue to go down.
All right. Well, thank you, Bobby. Thank you for your information. And I just want to let people know that if you are in need of a COVID test, we do offer a clinic on Tuesdays from 3 to 5 p.m. in the Elm Street parking garage. So if you can call ahead to 589-3456, we'll be happy to make you a 5-minute time frame appointment. And you stay in your car so you're not getting extra exposed. And so we just want to encourage people that if you do need that test, we are available on those Tuesdays from 3 to 5 p.m. Again, thank you, Bobby, and we'll see you next week.
All right. Thank you, Jane.
The use of face masks in public may reduce the spread of infection in the community. Everyone can help prevent the spread of respiratory droplets even when not feeling sick. Face masks or cloth coverings can be handmade or purchased. Medical face masks should be saved and used by healthcare professionals. Wearing a face mask will help protect people around you, including those at higher risk of severe illness from COVID-19 and workers who come in close contact with other people. Wear a face mask in the community when visiting indoor, crowded, or busy places. Face masks should be worn along with physical distancing, covering a cough or sneeze, washing hands, and avoiding touching your nose, mouth, and eyes with unwashed hands. Using face masks in a safe way is important. Face masks should cover your face from the top of the nose down to your chin. Clean hands with soap and water or sanitizer before and after touching your mask. Remove the mask from the ear loop. Do not touch the front of the mask. If disposable, throw away in an appropriate container. If reusable, wash often with hot water and regular detergent. Encourage others to participate and practice safe and healthy behavior. Thank you, Greater Nashua, for helping to slow the spread. For more information, you can visit the Centers for Disease Control and Prevention, Proceedings of the National Academy of Sciences, The Lancet, and Yale Medicine.
Welcome back to Public Health Matters. I'm joined by Nicole Vio, Health Communication Specialist, also at the division. You can give me your official title. So hi, Nicole, welcome, and tell us about what you do at the Department of Public Health.
Hi, Jane. Well, thank you. I'm very excited to be on, first time on Public Health Matters. So I am the Health Promotion and Communication Specialist, so you were very close.
I forgot a word.
It's
Sorry.
okay. So my job really focuses on health promotion and education within the region. So the main goal is really to get health information out to our community members, really to create that healthy behavior change. So I work with all the departments within our division. I'm really lucky to be able to do so. They're awesome, awesome people. Working on marketing, communications, and branding within the division. Specifically for COVID, I'm the Public Health Information Officer for the division, and I also lead our city's Joint Information Center, which is a great team that we have with city employees that are all focused on communications, and we work together to ensure that accurate information is going out to our community during this time.
So it's been pretty busy.
Very busy, but exciting busy, yes.
So, I mean, I know some of this because I work directly with Nicole, and we do a lot of communications work. Tell me some of the places we can see some of the public health things. I know that bus shelters, for example, billboards. Where else have we hopefully gotten our message out?
Yeah, so we hope that you can see us everywhere, driving down the street, pulling up your cell phone, just anywhere. We have everything from billboards to bus ads. We're all over social media. We have Facebook, Twitter, we have Instagram, we even have a TikTok, so we made a dance video. But yeah, we really tried to push that information out so we can meet the needs of all community members.
And I've also noticed you're not just pushing out COVID messages right now on for example, on Facebook. You're really pushing out all sorts of seasonal things for the division.
Mm-hmm. Yep, so I work on marketing plans with all the divisions throughout the year. So we go in phases, but I'm always pushing out general health information, but it changes by season, it changes by month. So right now it's August, we're really focused on National Immunization Awareness Month. It's also National Breastfeeding Month. So we're pushing out COVID information every day, but we're also not forgetting about those other areas that impact health as well.
Right, and that's really important. We don't want to forget about all the other health conditions, and if you happen to be live with a chronic condition, we want to make sure you're still seeing your doctor. There are safe ways to do that. We want you to take care of yourself, not just neglect your health care because it's a pandemic. We have to, and so some of the work is picking up. That was kind of I like to say the pre-COVID, the post-COVID will never be the same kind of thing, but some of the work is picking up now for you that kind of got pushed a little bit to the side. And one of those things is the community health assessment.
Yes.
And that's really critical to the Nashua area. So can you just tell us first and foremost what the community health assessment is?
Yeah, definitely. So when COVID started, it was so new, we kind of jumped right in it. We were learning, we were also educating the public at the same time. But I'm really happy to also be able to hire some new staff. So lucky to work with you, Jane. But I've been able to jump back into some of the old work that we were working on before COVID entered the state and entered Nashua. So right now I'm actually picking up some work again on our community health assessment. So our community health assessment is really a process that we use to identify the health of our region and really just take a broader look at the health within the greater Nashua region. We do this by looking at the strengths and resources, but by also looking at the concerns and needs. And what happens when we look at that data and information is we're able to then identify and develop goals and objectives, as well as strategies and initiatives to then improve those health outcomes.
Mm-hmm. So we're looking at data that's collected where, and then there's a couple pieces, right? There's the data that we're collecting through the state, or is that through different surveys that are already going on? So we're pulling some of that. Can you explain some of where that comes from?
Yep. So actually, we are looking at data and information on risk factors, mortality, morbidity, big on social determinants of health and health equity. So we're looking at data that's within the greater Nashua region, but also the state of New Hampshire, and we're also looking at some national data as well. So like you mentioned, we're pulling data that we find from the state. We collect some of our own data through our programs and services at the Nashua Division of Public Health. But all of that information is actually being pulled together, and we're excited to announce that this year it's going to be live data on our interactive data dashboard. So we won't have a static document for people to scroll through, which was always great, and people used it, but now people are going to be able to view our community health assessment on our website.
Yeah, and it's really, really cool. I can just attest to that, that you can get a daily update, or, whenever it, you can see when it was last updated, when the latest data comes in. And I think it's pretty environmentally friendly too, instead of picking up, publishing these large reports every time and trying to disseminate them. It's right there, it's live. So it's really exciting.
Exactly, and like you said, it's live, so it's continuously updated. The information will be continuously updated as well. So for example, when the state updates their website, will automatically be updated on our community health assessment. We won't have to wait another 3 years, which is when we normally do our community health assessments. We'll be able to do it in real time.
That's great. So we'll save time.
Yes.
And paper.
Excited.
Yes. So then we also have, as a piece of this community health assessment, which is why we brought you here really to plug this hard, is the community health survey. And just tell me about what that means and what that means to our audience, because we really want some participation in this.
Yes, so I have another challenge. So we have the mask challenge, and now we have Take Our Survey challenge.
Everyone's going to be so busy.
I know. I'll post about it on Facebook. So a way for us to collect some primary data from our community, because it is a community health assessment, is a whole community approach. We really want to learn about people's perceptions of health in their community, and we're also using this as a way to hear about their COVID experiences. So if you go on our website, and the links will be on this as well.
Yes, we can post that now while you're speaking.
Yes. So you can take a quick survey, tell us your feedback. We have enough questions. I know you've taken it, I've taken it as well, but we really encourage you guys to share your feedback. So we can really use that information and data for us to change and enhance our programs that we currently have running. It's not just for us, it's for our partners as well. It's to help program evaluation, to help program planning. We can use that information to apply for funding and grants and really make our community a healthier place to live.
Right, so it's really targeted. So if we don't have that information, we don't do any, public health people love data.
Yep.
So, Bobby said that, and, you're saying that now. But we want to target our initiatives, because funding is limited. So we want to, really understand where the needs are in the community. So if people can take the time, we will be posting again those links during the show. But you can just go to our website, to the Nashua Division of Public Health and Community Services, and you can find the link there as well to take the survey. And there's a special incentive?
There is. So first I just want to mention our survey is in English and Spanish, so it's available both ways on our website. And yes, there is an incentive. So everybody that takes the survey, you're entered to win a $25 gift card to a local place in Nashua. To date, we've given out, I think, about 12 gift cards. I just put 2 in the mail this morning. So 12 people have already gotten $25 gift cards just for taking 10 minutes out of their day to take our quick survey.
That's great.
Yeah.
And I don't want to confuse things that, we have this mask challenge, and we also are challenging you to this. You do not need to wear the mask while you're taking your survey
unless
at home.
Unless you're
doing it in public. But just want to be clear. We just don't want people to feel like that we've assigned them too much to do. So that's great. So Nicole, thank you so much for coming on and letting us know about this community health assessment and also the survey. Very important for people to participate. And it helps us help you.
And we want to hear from you. Your value does really help us in program planning and what we're going to be working on in the future. So feel free, take the survey, spread the word, tell your friends, tell your family. We really want to hear from people.
Great.
Thank you, Jane.
Thanks, Nicole. Welcome back to Public Health Matters. I have in studio with me now Heidi P. Kukoka, who is the Health Officer for the Division of Public Health. Welcome, Heidi.
Thank you, Jane. It's a pleasure to be here. I appreciate the invitation.
Well, we're really glad to have you here. Having you here really goes along well with what we've previously discussed today. And so first, let's just start off. Tell me what you do at the Division of Public Health, so give people some context of why we invited you here today.
I serve as Nashua's Health Officer. My jurisdiction is just for within the city. I oversee the Environmental Health Department. We have a total staff, including myself, of 6, and we conduct food service inspections normally. We do institutional inspections of schools and child care facilities and foster homes. And we also respond to citizen complaints of anything that is perceived to be a public health matter. And we also do some plan approvals for subdivisions and for septic systems. And generally, if it's an icky thing, environmental health is involved in it.
So the icky thing. But I noticed one word you used there said normally. So
yes.
I think that normally refers to the fact that nothing is really normal right now.
No.
And we are in the midst of the COVID-19 pandemic. So how has your work changed over the last 6 months, really?
Well, we used to think that we were very busy. Right now, we're juggling a lot of things, and we're making decisions on a pretty regular basis about what's our saturation point, what can we do, what shouldn't we do at the time, where do we need some extra focus on things. So we're pretty much shifting and changing all the time, and environmental health staff have taken on a lot of additional duties like covering the hotline, calling the contacts of the positive cases back to make sure that they're okay and they're not flaring up with symptoms. We're also calling back negative cases to let them know that their testing results came back negative. And we're just kind of immersed in this with the division. And one of the other duties that I took on for a period of time was the role of safety officer for the city. And I helped look at how we could repopulate our positions in our workforce in a safe manner, considering where they worked, what functions they performed. And so suggested things like what you were talking about previously, like mask use, social distancing, cleaning of surfaces, and just kind of feasibility for distancing. None of us have a huge, gracious, palatial place to work in. So
Right. And so you lead me perfectly to my next question, which is one of the biggest reasons we want to speak to you today is that we are opening up. People are back to work.
Correct.
And as we work with the nurses and we hear where cases are happening, we're finding that there are cases in work sites where the social distancing isn't possible. So getting back to work safely is a really critical thing, which is going to be happening more and more. But let's just use an example, and we won't name names, of course, but if you're, for example, a mover and you work in a crew or any kind of job or environment where there's like a crew that has to go out together.
Yes, and the city example and where we came up with our initial guidance was with public works, and to give them credit, they had raised these concerns about we've got a couple of guys in a truck together, they're scheduled to be on a whole route together, what should we be doing with them? So we started thinking about it, we started coming up with some guidance, and so when people are in confined spaces and they don't have a mask on at the time, they can obviously pass along a lot of stuff to each other. And so the trucks, there's not a lot of separation in the trucks. And then when they're working at a job site, they may be doing something, depending upon what the nature of the business is, in a very confined space as well. So that's of concern. And then if they are not able to wash their hands well during in between tasks, that's of concern. So we were able to help Public Works specifically with recommending that the guys who are in the trucks should be wearing masks. Sometimes I know that, excuse me, other businesses as well, we've talked them through, maybe you could send out a person in a truck if it's for a long period of time. And then when the work is actually occurring, if it's indoors and tight quarters, you need to think about, is there a way to separate people a little bit? And so it's a different challenge than working within the office environment. But
it's still a challenge.
Yes.
And you read about like the tailgate huddle. You know, you can kind of picture it. You're on a job. You want to talk to each other right beforehand. You know, who's doing what. But even at that time, if you're going to spend 10, 15 minutes in a meeting all next to each other, even if it's outside, we would recommend wearing a mask.
absolutely.
Yeah.
Yes. And it will be a little bit different, and we're going to have to switch gears a bit when it starts to get colder out and people are still expected to go places in vehicles, and still some of them will be working outside. There is a big dilution factor outside when it comes to the natural airflow that's happening, unlike a building. But it's not a guarantee that people are safe if they're this close together.
Right.
And trying to do something collectively and in each other's breathing zones without the protection of a mask. And it's hard to accomplish in some of those high temperatures, as it will be in cold temperatures, to wear a mask on your face. It's a little hard for some of those people to try to figure out how to kind of balance their health and their comfort.
And it's definitely a challenge.
Yes.
For people. And even if they're riding in a truck, I mean, this is an example that has come to our office several times of people, you know, cohorting in their truck. And so if one person is COVID positive, they've exposed the other person, especially if they're not wearing their mask, then they're going home to their families. So really, nobody's exempt from these rules, as I guess is what I want to say, and we want to emphasize, especially for workplace safety.
Right. We want to break that chain someplace. And so one of the things that you had talked to Bobby about, and some of the things that we're familiar with in public health as a field, is that contact investigation and breaking the disease cycle. And so we looked for logical ways to do that. And so what we came up with was the best that we could at the time, but it's always changing a little bit, and it's pretty much a real challenge.
Right. So because it's always changing, we go with the best information we have right now. And the best information we have is that everyone has to think about this. And people want to get back to work, and we want people to get back to work, but do it safely. We can use an example also of a restaurants and the restaurant crews. And if you could maybe speak to that a little bit of, you know, how do you get back safely or continue? Because,
right.
You know,
well, if you think about in restaurants, and restaurants have had a really hard time because they were shut down for a period of time, and then they were allowed to start up with outdoor dining, and then they moved to, for us here, 50% capacity indoors. But there were all kinds of things all kinds of guidelines that were given to them as well. But prior to that, they had a significant staffing shortage too. So they've had a tough time. And right now, people don't realize how close the quarters are in some kitchens. Not all of them, but some of them. So they're working right on top of each other.
and it's hot, I would imagine.
And it's very hot. If you've got pizza ovens going all the time, you have woks going, that's a lot of heat being generated. So it's hard to keep something hot on your face. But so some of this is up to them. They need to take a look at what's the best practice, how do they keep COVID out of their facility. One of the other things that we recommended, and we're doing internally as well, within our division and more broadly for all of city employees is screening too. And so there is some good guidance out there on how employers can screen their employees on a daily basis. So that's an important key as well. So we ask them about symptoms, whether or not, and we do recommend that they get one of the no-touch thermometers and screen people when they start their shift. And we also ask that they have a really good exclusion policy for when people are sick, that they not come to work, because then they're just coming in and sharing it with people.
And we hope that like employers also are understanding that and not punishing the employee, because if we can adhere to this together and we can really follow these guidelines, again, it's that, you know, controlling it at the source and nipping it in the bud. So these are difficult things, and we really, I would love to give a shout out to the restaurants, because this is such a challenge for them. And I so appreciate that I have, after 5 months, finally had an outdoor meal and stopped cooking so much. So your efforts are not going unnoticed. We really appreciate that. We just want you to, you know, keep it up and stay vigilant. And, you know, if the cooks or whoever's in the kitchen needs a break, you know, prepare yourself for those breaks, because, you know, you have to get out of that heat with the mask on. And we do the same thing in our office, or we have a testing clinic. I said, you know, I raised my hand, I said, I need a mask break. So, you know, I walk away from the group and I can take my mask down. We're outside, it's comfortable. So it's the same idea for everybody. So, so you tell me a little bit, because this has been going on. You've worked a lot about event planning in Nashua and outdoor event planning mostly. Can you tell us a little bit about that work and the challenges with that?
Yeah, certainly. Prior to COVID, we were mostly concerned with general sanitation of a public event, and certainly the food service aspect, what food or beverages were going to be offered to the public. And so we would work through our forms that had been developed, I think, back in, 2002, something like that, and or 2012.
Guess it's time for new forms.
Well, they've stood the test of time. They actually aren't that bad. But so now we're looking at it more generally. How can, and for an example, we're asking how can the event coordinators ensure that attendees are going to have some safety precautions in place, such as requiring participants to wear a face covering, making sure that there are hand washing and hand sanitizing facilities available, trying to find some way to limit the number of attendees, and then trying to physically space them as well, so that, you know, a household can have this designated area. The most recent one that will be coming up, and I don't have the date right on the top of my head, is Dancing in the Park.
Oh, right.
And the event coordinator has done a tremendous job in figuring out, okay, a family unit or a group can be in this square, and so spacing it off, limited number of tickets, and then we also want to know at least a name and a phone number of attendees, so that if something happens that is associated with that event, we can go back and do a trace back, which takes us right back to our public health home.
Yeah, so things in the past that we might not have had registration for, we're registering people. We're asking people to sign up for events, and that's really important. And I think that's an important message for the public as well. You know, don't just show up. It's, you know, those days are not here right now.
Right.
So if there is a registration, please use the registration.
Yeah, I think
for outdoor events, not for a testing clinic.
Well, I think a lot of this it requires a certain level of mindfulness and intention. And yeah, my husband tends to be very spontaneous and will just want to go here to go have lunch. It could be, you know, an hour away, but we need to think in things a little bit differently now and think about safety as one of those considerations. And so we don't want to just show up to something for which we're not necessarily ready. Maybe we don't have masks for the kids in the car. Maybe we, were omitted something that we should have as a supply. Maybe we don't want to go too far without some sort of a hand wipe in the car.
Yes, it's
to
almost like
clean
this
down.
COVID kit is replacing our first aid kits or supplementing them
Yes.
with the hand sanitizer, the wipes, maybe, a supply of water and those kind of things so that you can,
Yes.
go out and leave the house and enjoy the summer safely. And that's our big message. Whether it's getting back to work or doing an outdoor event, again, don't just show up, register so that we can, if there is a problem, we can find you and
Yes.
we can let you know. And so thank you, Heidi. Thank you so much for
thank
joining me
you.
today. This is really helpful information, both for our local businesses, and hopefully we'll get everyone back to work and safely.
I hope so.
And so, again, thank you for joining us today for Public Health Matters. I do want to remind folks that we do have a clinic every Tuesday from 3 to 5 at the Elm Street parking garage. You can make an appointment by calling the COVID hotline. That's 589-3456. And thanks again for joining us. We'll see you next week.